Welcome back. Now, as Namibia joins the rest of the world in marking World MS Day, Multiple Sclerosis Namibia, in partnership with Coca-Cola Namibia, will be hosting the annual Run for Multiple Sclerosis under the theme #Run4MS, and it's happening on the 30th of May. The event aims to raise awareness, of course, about MS, support people living with the condition, and raise funds for multiple sclerosis patients' support programs within the country. Our participants will have the option to take part in a 5, 10 or 15-kilometer run, either in person or virtually. To tell us more, we are joined by Bianca Ozcan, who is the founder of Multiple Sclerosis Namibia, as well as Airofaan, Chairperson of the MS Running Committee. Bianca and Airofaan, good evening. Thank you so much for joining us.
Thank you for having us.
Lovely having you here with us. Thank you so much for your time.
Thank you.
Well, to start with, Bianca, for viewers who may not be familiar with what exactly MS is, talk to us about this disease, just very briefly.
Multiple sclerosis is a chronic neurological disorder that affects the central nervous system. And the central nervous system is made up of the brain and the spinal cord. So it depends on where your axons is affected and where inflammation occurs. That means the myelin sheet, which is the protective covering of the nerve, starts then to break up. And then messages supposedly to be sent from the brain to the rest of the body gets disrupted. And that's when MS actually starts, or the symptoms basically starts.
What are the symptoms and how does MS, show up in your body?
The common symptoms are very common, and that's why they are most of the time overlooked. Yes, exactly. So it starts off with blurry vision and dizziness or trouble swallowing, but very mild in the beginning, and also fatigue, which we assume that I'm overworked, so I'm just tired, but it's actually more than that. And then also loss of balance.
Well, we're talking about the annual run in commemoration of, MS. Talk to us about the annual run, Airofaan, for multiple sclerosis, and of course, the purpose behind this event.
Okay, the run will be taking place on the 30th of May, which is end of the month. It's also National World MS Day. So we encourage people to wear orange just to support the illness. Most probably it's just for awareness and to support patients with MS. Yes.
Well, I know we've got MS Namibia, and you've been established for quite a couple of years, Bianca. How common is multiple sclerosis in Namibia? And of course, we know that there's never enough awareness we can give around this condition, because as you said, it gets overlooked so often.
Yes.
Yeah.
In fact, I was looking at one of the questions that asked how much awareness are being done about it. And I'm like, we are here for such a long time now, but there are still people that do not know about MS. And especially for sub-Saharan Africa, it is still considered a rare condition, whereas in Europe, Africa, and Asia, it is very common. And that all boils down to one thing, which the low prevalence is definitely because of data, misdiagnosis. So there may be people that are actually living with multiple sclerosis, but they're incorrectly diagnosed. And for that purpose, they are not on the data for MS in Namibia, for example. So things just slips through. But from our side, we're really doing our best to make sure that there's enough awareness going around.
You're doing a fantastic job, if I must say so myself.
Thank you.
Airofaan, talk to us about who's invited to participate in this run. 5 kilometers is now for us unfit ones.
Yes, you can
We
walk.
call it a fun run, yes. So who can participate in this run?
Okay, it's open for everybody. You can even, it's a nice day to take the dog for a walk. We are doing 5 kilometers or so. And then we'll be having 10 kilometers and 15. So you can bring your husband, your wife, your kids, everybody can join the race.
Fantastic. Well, of course, there's going to be registration that needs to happen. So for somebody who's interested, how do they go about registering and then choosing the kilometers, etc.? Talk to us about that.
Okay, there's a link. You do it through web ticket.
Okay.
Or you can either go to Model, or you can physically go and register there, get your token there, and yes.
All right. Well, Bianca, just lastly, before we start rounding off our conversation, I want to know, what some of the biggest, challenges are for the individuals that live with MS? Like, what are their daily lives? Just because what I understand from this disease is that it deteriorates over time. There's no cure for it, and basically you can just manage, the disease. So talk to us about the challenges that individuals who live with this disease face on a daily basis.
Thank you for that question. It is so important, and also that the public are aware of it and can hear this. Number one would be access to specialized neurologists. Namibia's specialized neurologists are very limited and they are very expensive. And secondly, the cost for treatment. There are 3 treatments available for low middle income countries, which has been approved for the essential medicine list. And currently we are struggling to actually access those through state facilities. And to purchase it out of your own pocket is not possible, because we're looking at plus minus 30,000 per month per patient.
Sure.
So it's ridiculous amounts that we are looking at.
Yeah.
So that obviously makes a huge difference in terms of what do we do as an organization? Who do we help? Who do we say no to? Who do we say yes to?
Yes.
It becomes very, very difficult.
Yeah.
And I also want to add on here, we have about 30% of MSers on our list that has access to medical aid.
Okay.
Which means 70% of them are either left for their own sorrow and family members to help put money together, and most of them, because of the condition, cannot work any longer, also depending on the severity of their condition. And then again, there's still very much a lot of stigma involved when it comes to MS and employers, for example. The moment the employer hear the individual have MS, then you are immediately seen as somebody that cannot add value to the company.
A liability now.
Or you cannot think or concentrate good enough anymore. But that is not the case. That's really just a myth, and it depends on the severity of the MS the person is being diagnosed with. And also, we're also looking at a lack of community engagement and family support.
Yeah. Well, it's happening on the 30th of May, and that's the day that World MS Day also happens. And tickets are available on web ticket. But just as we conclude, Bianca, perhaps, and Airofaan, you can go second. A word of encouragement to Namibians on why they should, involve themselves and participate in the commemoration day in relation to bringing awareness to multiple sclerosis, Bianca.
Anybody can get MS. Anybody can get diagnosed with MS. So it's a matter of being human enough, being kind enough, and just coming forward and support those that is living with multiple sclerosis. It means so much, even though we cannot provide the treatment for them, but we can be there in person and just give a hand and support.
Airofaan, your final remarks?
Yeah, just to be aware so that you know when the symptoms are there, and also to support financially. Yes.
Well, thank you so much for being here this evening. I appreciate it, and thank you for your time, and all the best with the run.
Thank you. We hope to see you there.
Thank you so much.
Thank you.
Bye.
Well, there you have it. We've come to the end of this evening's edition of the Daily Roundup. Of course, we're back tomorrow, same time and place, so join us then, and thank you for watching. Good night.